Hello everyone, how are you today? Welcome back to my channel. You're watching Dr. Education and I am Dr. Paramjeet. And those who don't know me, I am a consultant physician cardiologist in Yashoda Superspeciality Hospital, Nehru Nagar, Ghaziabad, Delhi NCR. So this is my channel and I make health education videos, simplified medical explanation videos here, and you can find a lot of videos on my channel. You can browse and look for your favorite topic and know about it in a simple language. So today's topic is a very common, very frequently encountered problem nowadays, especially in youngsters as well as in teenagers, even in adults and elderly. So it's very common, but nowadays it's more common in youngsters. This is actually one of the top searched health topics on Google. So today we are going to talk about anxiety. Yes, fear, anxiety and depression are very alike, but they are not the same. So we are going to discuss about anxiety, and we are going to discuss what is the difference between a normal anxiety and a pathological anxiety, and what can you do about it? What are the medical ways to treat it, and what are the natural ways, what you can actually do on your level to make sure that you do not have anxiety anymore. How to tackle an anxiety attack, how to decrease the frequency of anxiety episodes, how to deal with anxiety, what are the ways. All these things will be discussed today. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Guys, anxiety and fear are very important in your life. It is important to be anxious and afraid when you're going to take a test. It is important to be anxious and little afraid when you're going to walk in a dark street, because that makes you, that fear, that anxiety makes you more alert. That increases your carefulness. That can increase your performance. So that anxiety, that fear is necessary. But in many people, this fear, anxiety does not stop. Normally, whenever this phase of a test or the dark street ends, whenever you go out of that anxious environment, immediately or very soon, your anxiety, your fear should get relieved. But for many people, it stays constant. Rather, sometimes it gets worse. And these people may even develop symptoms just because of anxiety and fear. Constant anxiety and fear can lead to various symptoms, varying from chest pains to nightmares, insomnia and weakness, body pains, even fever sometimes happen because of anxiety. So anxiety and fear can lead to a lot of problems if it is constant. Such people who are always anxious may be afraid to do things. They might be afraid to even go out of the house, to do any work, to study or to work in an office. They might be afraid to even talk to people. So this kind of things are nowadays very common. Let me tell you guys, if it is that stage, if someone you know is in this stage of fear of doing things because of anxiety, he might need medications or therapy, counseling, or even sometimes both. So the treatment for an anxiety disorder are medications given by psychologists, psychiatrists, or psychological counseling, which can be done by a friend or parents or sometimes a psychologist or even psychiatrist. But there are some things which you can do. There are many people who know they have anxiety, who know that they cannot manage anxiety on their own and they need help. And they are willing to do whatever is needed. For such people, there are ways. The biggest and the best way of managing anxiety disorders or anxiety attacks or decreasing the frequency of anxiety is exercise. Yes, regular exercise is the best treatment. Why? Let me prove you. Regular exercise produces hormones. Regular exercise produces feel-good endorphins inside your body. These are natural endogenous cannabinoids. These cannabinoids increase your feeling of well-being in the body. That means that if you regularly exercise, you start feeling good. If you start feeling good, you tackle depression, anxiety, and fear. This happens. Second thing, if you exercise regularly, your mind is off of worries. Your mind gets off of worries. You get free from the cycle of negativity, which is the core cause of anxiety and depression. Third, you gain confidence. You gain confidence because you're getting back in shape, because you're losing weight, because of the endorphins, because of the confidence, because you're achieving goals in exercise. And for that, it's important to keep goals small and achievable. Easy goals. Doesn't matter if it is easy. If you achieve them, you'll gain confidence. It's not necessary to do a perfect exercise workout. Fourth, exercise regularly may increase your socialization skills, because you might go out for a run, you might go into the gym, and even a simple gesture of smiles or waves or handshakes or greeting someone can increase your mood, can elevate your mood. Fifth, regular exercise is the best way of coping stress. You don't have to cope stress with alcohol or food. Binge eating is not an answer. Alcohol drinking is not an answer. Exercise rather is beneficial and is very effective. Being in isolation is not an answer. Cutting yourself out of the world will not solve your problem. All these things, alcohol, eating, isolation, will increase your problems, but exercise won't. 6, exercise will lead to weight control. If your weight is controlled, if it is high, you can lose it. If it is low, you can gain. If your weight is ideal around, you'll gain confidence. You'll be feeling good. 7th, regular exercise help you sleep better. If you sleep better, a good sleep has so many benefits, including anxiety, including in stress, including in health and disease preventions. 8th, you can actually prevent a lot of diseases by regular exercising. These diseases can be because of high cholesterol, high blood sugar, lipids, high sugars, high insulins, even heart diseases, strokes, even cancers can be prevented by regular exercise. You can increase your BMR, your basal metabolic rate, so you boost your own energy levels. You are more active, more focused, more confident the whole day if you do regular exercise. Regular exercise even helps you quit your addictions. If you have an addiction towards smoking, if you're addicted to alcohol or any drugs, exercise is the key to quit your addiction. Then sexual health. Regular exercise is one of the best and proven ways to increasing your sexual performance, increasing your libido, and relieving your sexual anxieties. All these benefits by just exercising. Plus, exercise also elevates your quality of life. And the last thing which exercise does for you, you won't believe it, but it's true. The only thing in the world which can increase your life expectancy is exercise. If you exercise regularly, you will live longer, no doubt. So all these benefits are there by just regular exercise. So exercise is the best treatment for anxiety. But how much should you do it? You should do 2.5 hours of moderate exercise per week at least. That's the minimum. Maximum you can go as much as you like. So 2.5 of moderate, that means brisk walks or light jogging can be done, or slow swimming or cycling. All these things are moderate exercise. Skipping, all these things are moderate exercise. And if you don't have time, if you regular exercise already, then you can go to a vigorous exercise plan. In vigorous exercise, you can do just 1 to 1.5 hours of vigorous exercise per week, but not in a straight run. You have to divide it in the days. So 1 to 1.5 of vigorous exercise means running vigorously, swimming laps, and any kind of vigorous exercise, jumping. So vigorous exercise or moderate exercise is required. Just walking is not exercise. It is just physical activity. There is a huge difference between physical activity and exercise. If you walk for half an hour, it's not exercise. You have to brisk walk. There is a difference between walking and a brisk walk. I'll make a separate video on differences between physical activity and exercise soon. So these things are important to make note. Other than that, frequency is the key. Many research studies have shown that people who have a regular exercise frequency have shown all these benefits of exercises in a very enhanced way, and they have the best results. So let me give you a few tips. If you are not very regular in exercises, how can you actually start doing it and do not fail into it? Because there are many people who start exercising but cannot continue, stop very soon, or they find it very difficult or very difficult to achieve results. So the first thing you need to remember is you have to have goals, and the goals need to be very small. Yes, small goal which you can easily achieve, because that's important to achieve goal. Doesn't matter how small is the goal. So first step is to achieve a small goal on a regular basis. If not daily, 5 days a week. That should be the minimum exercise you do. Second is routine, consistency. Daily means daily, no matter what happens. Make an alarm, schedule it, and make sure it happens. Third tip, make it fun and enjoyable. Sometimes you can join a class, sometimes you can do it in a group activity. Whatever makes it fun for you, you make exercise fun. Fourth, you can have an exercise buddy. Having an exercise buddy, a person with whom you regularly exercise, has shown that people who do this have a higher tendency to keep exercising and even have more enhanced results because of this. And the fifth and most important tip in exercise is be patient. Relax and be patient. Exercising regularly will not show results overnight. It takes 4 to 8 weeks before you start feeling better. You might feel better after a few days, but for a considerable significant results, you need to have a consistency of at least 4 to 8 weeks, and then you'll start showing results, and then it's all uphill. Then results will go on increasing exponentially. So that's why, guys, exercise is your key to relieve your anxiety, your fears, your depression. So apart from exercise, there is one more thing which you can do if there is an anxiety attack. You can distract yourself. You can use music or videos or television or iPods, iPads, anything which distracts you from the anxiety issue. That can be done. If nothing works, then do not hesitate to go to a psychiatrist and get yourself evaluated for any possible organic reasons. In your case, the doctor will help you out to a proper plan of management for your particular case. So guys, hope you are liking the videos and hope you learned something from this. Don't forget to share this video in all your social medias, and don't forget to subscribe my channel. I'm Dr. Paramjeet and you're watching Dr. Education. Stay connected, stay healthy.